So this was one particular disorder found in our text, that is Rudrog, which we can correlate nowadays with the cardiac disorders that we, or the cardiac symptoms what we come across. Is there any other reference? Yes, there is one more reference of a disorder uh, in Raktapitta. In Raktapitta, there is mention of Grathita Raktapitta. Now, that reference is not too relevant to what pathophysiology or the pathophysiology of atherosclerosis, what we come across, but yes, there is a mention of Grathitata. So, here we get some clue that clotting, or sorry, the coagulation or the Grathitata can come or can occur in blood. So, this was judged by our acharyas some years back, and this proves a good evidence of that particular statement, that there can be a grathitata in rakta. Then there is another disorder, medorog, which has been mentioned. Now again, in medorog we can't say that this can be correlated with atherosclerosis, because there is a reference of apachit medadhatu in medorog, but there is no reference as such found that this apachit medadhatu gets lodged somewhere into blood vessels and causes a narrowing of blood vessels and leads to the entire formation of atherosclerosis. Such kind of description or reference is not found in medorog, but yes, we can correlate it with hyperlipidemic states and the further manifestations of hypercholesteremia to these cardiac patients. Now there is one disorder mentioned by Acharya Sushrut, which again doesn't signifies much importance towards the pathophysiology but towards the symptoms, and that is Rutshul. So what Sushrut has stated about Rutshul is that Kapha Pittava Ruddhastu Maruto Rasa Murchitaha Rudistha Kurute Shulam Uchvasavarodhakam Sarutshula iti Khyato Rasa Maruta Sambhavaha. So again here we should note that Rasadushti is the main causative factor in any kind of Rudrog. So over here specifically when there is Rutshul, as we discussed previously, the Rasadushti is predominantly occurring because of vitiation of Vata dosha, and whenever such Vata dushti occurs in Rasadhatu and that Rasadhatu reaches the heart, that particular pathology leads to formation of a symptom in a form of Rutshul or cardiac pain. So somewhere we can correlate this process with angina pectoris, but then we can't correlate this process with the much talked atherosclerosis and the myocardial infarctions or conditions like that, which are quite enormously discussed nowadays. Now there is one more disorder which is this is very tricky to understand why this disorder is our topic of discussion in Ayurvedic pathophysiology today. But yes, as we move ahead, you will come to know that yes, this disease should be discussed while we are going through Ayurvedic pathophysiology for cardiac disorders. And this disease is Gulma. Now, when I say Gulma, there may be so many questions arising in your mind that why Gulma is our topic of discussion in this particular in this particular discussion of ours. So let's go into the details of this, that why we are studying Gulma while studying the Ayurvedic pathophysiology for cardiac disorders. Does it have some correlation with the atherosclerosis or myocardial infarctions or coronary heart disease? What is it? Let's have a look at it. So till today we were not as we had a look at the probable disorders which could be correlated with the coronary artery disease pathophysiology or something like that, but we are not too sure that which pathophysiology is mentioned in Ayurveda which can be correlated exactly or which just fits into exactly the terminologies or the pathophysiology that has been mentioned for coronary artery diseases like atherosclerosis, etc. But yes, our acharyas had mentioned this particular disorder called Gulma, which had all the symptoms similar or which has all the pathophysiology occurring similar to that what occurs in coronary artery disease or the coronary heart diseases. So let's have a look at what all has been mentioned by our acharyas. Now, if we consider what the modern pathophysiology or how the modern pathophysiology describes the functioning or describes the pathophysiology of formation of this atheroma, we come across the terms like they have mentioned that This atheroma or this plaque can be mobile or it can be stationary. That is, it can stay at a particular place where it has formed, or it can dislodge from that site and can reach to some other site of location and can get lodged there. Secondly, they have also mentioned that this plaque can remain at the same size and it can regress or it can progress. That means it can increase progressively in its size or it can decrease in size. So similar description can be found while describing, which is mentioned in the description of gulma. Acharyas have used specific terms like it can be sanchari or achala, that is it can be mobile or it can be achala, that is stationary. Secondly, they have also mentioned that this gulma can be chaya or apachaya. That means it can undergo chaya, that is it can increase in size, or it can undergo apachaya, that is it can also decrease in size. So these 4 points which are mentioned while describing the pathophysiology of gulma are very much nearer or very much relevant to the pathophysiology that is seen in the formation of plaque as well. Second important point is that the site of formation of gulma is mentioned to be at the site of ruksha sira. Now siras are nothing but the blood vessels. Similar kind of description can be found in case of atherosclerosis also. That is, as you all know, it occurs at the site of blood vessels, so that is very obvious. But this term rukshata, which has been mentioned, that is a ruksha sira, has been mentioned by our Ayurvedic texts. It signifies that due to excess vitiation of vata dosha, there is a rukshata created at the site of blood vessels. Now, whenever there is apachit mera dhatu in circulating in the body through the blood, this mera dhatu gets lodged over this ruksha siras which are generated to reduce its rukshata. Later on, more and more mera dhatu gets lodged over that site until it completely or partially blocks that particular blood vessels. Similar description is found in pathophysiology of atherosclerosis. Over here we are talking about the ruksha sira, and over there we can correlate this with the endothelial integrity. Now endothelial or the intima are the lipid base layers. They require some snigdhata, we can say, to maintain the proper integrity of that endothelium. Now whenever this snigdhata is reduced or endothelial integrity is reduced because of any causes, like there are many causes which can disrupt this endothelial integrity. So due to this disruption, this rukshata which is created at the site of the endothelium triggers the deposition of the free flowing LDL cholesterol from the blood at that particular sites, and the same process continues. So this rukshata that occurs at the site of sira can be correlated with the disruption of the endothelium that occurs at the site of blood vessels. So this is another important point which can be correlated with the pathophysiology of atherosclerosis and that of gulma. Then again, the sites of gulma which have been described by our acharyas are mentioned as Rudayam Dvau Vakshasau Antaram. So here we can consider as Dvau term to be considered in case of Ruday or in reference to Dvau Parshva. If we consider it in reference to Ruday, then that goes more relevant for us in understanding the pathophysiology of CADs, because the plaque formation can occur at the site of Ruday or at the site of brain. As we all know, clot formation can occur at the site of heart and at the site of brain as well. So this concept of giving this or indicating these locations for this process of gulma signifies that here Rudaya Dvau is mentioned for the Mastishka Rudaya and the Urastha Rudaya. So this pathophysiology can occur at both these sites. Now we'll have a look at how Sushruth has described this entire pathophysiology of gulma. He has stated that Rudbastayontare Grantihi Sanchari Yadi Vachalah Chaya Apachayvan Vruttah Sa Gulma Iti Kirtitah. So he has stated that it can occur at the site of heart or at the site of basti. So we all know that this clot formation can occur at the site of pelvic veins also. So again, this shloka or this description also explains us the relevance between gulma and the coronary artery disease pathophysiology. Secondly, he has mentioned it as to be a granthi, that is a clump of aggregated cells, which is again a very relevant term used. Then, as we have already discussed, it can be sanchari or achalaha, that means it can be stationary or it can be sanchari, that is mobile. Then chaya apachayavan, that is it can increase or decrease in size. Vruttaha, it is circular in shape, and such pathophysiology or such disease process is considered to be as gulma. So this description again takes us very much near to the entire pathophysiology which has been described for coronary artery disease or the atherosclerosis formation.